Over time, do you think this kind of language begins to rewire people's brains and the way we think about healthcare? And how does that kind of rewiring, to the extent you think this commodity-based language is popularized, to what extent do you think that kind of makes a reimagining of healthcare as a right and as something that maybe is single payer that much more difficult, if not impossible?
Yeah, I think that that's absolutely the case. And I think that that's very much baked into the history of 20th century healthcare reform. During World War II and slightly after, there was a push for national health insurance, what we would think of today as single payer. It was also very popular, the idea that the NHS, the National Health Service in the UK, was also founded around this time. And Beveridge, the guy who comes up with this reform, was a very famous guy on the circuit here. He wrote a best-selling book. He spoke a lot. And so the idea of universal healthcare as a right was actually a lot more popular and a lot more common than it is now. The AMA and some other moneyed interests pushed back that particular reform by the late 40s. But, only 15 years later, they managed to pass Medicare and Medicaid, which doesn't go as far as national health insurance does, but, was still a major reform and extension of the public sector and the idea of healthcare as a right. And then since then, we've really, turned in a much more neoliberal direction. And I think that that's when you can start to pinpoint the rise of consumer rhetoric when it comes to healthcare, in particular insurance. I think that this happened for a variety of reasons that are mostly trackable in terms of macroeconomic trends. There's a lot of inflation in the 70s. There's sort of an abandonment eventually of any push toward universalizing a public sector program that kind of peters out a few years after the passage of Medicare and Medicaid. And you also start to get this rise of, more reactionary economists who write about healthcare and health insurance as a moral hazard. The idea being that to keep costs down, we have to basically optimize individual behaviors and make sure that people aren't using more healthcare than they actually need simply because it's free. I think that these ideas are very silly on their face.
Those greedy healthcare takers.
Stop going to all those doctors.
Exactly. I mean, I don't think that anyone enjoys doing these things.
Personally, I just had a kidney transplant for the hell of it.
Just for the hell of it, yeah.
Well, and it's probably because you weren't exposed to that cost because you have insurance, so why not?
It's true.
It's Friday.
It's true.
Yeah, I mean, I think that, as silly as it is, people still take this very seriously. I mean, that's essentially the logic behind cost sharing, behind deductibles, co-pays, co-insurance, is basically the idea that if you don't have any skin in the game, you're just going to force this poor insurance company to pay out the nose willy-nilly just because you're bored. Mm-hmm. So I think that trying to implement some consumer discipline and get people to use healthcare more responsibly is something that we start to see after that. I once typed in healthcare consumers into that Google Ngram one time, and it's just around here in the 70s that it just starts to skyrocket out of nowhere. And I think it's because of this market logic that really gets injected by some of these AEI fellows who start writing about it. Ultimately, I think that the rhetoric serves to shift the conversation from, a collective societal goal to a matter of individual prudence. It turns acquiring health insurance into an individual responsibility. And I think that we still see that a lot today in the logic of the ACA. The individual mandate is nothing else besides, basically a stick to make sure that individual people act as the most perfect possible consumers of healthcare. And there hasn't been, until now, I think, over the past couple of years, there hasn't been a major reckoning with this logic in the political sphere for a long time.
You spend a lot of time going from place to place talking about single payer and trying to convince people. I assume that this is probably the number one objection you get. This is a very popular trope in American culture, especially right-wing media. They completely erase the fact that almost everyone loves their socialized medicine in other countries, and that it's somehow uniquely un-American because it undermines our choice. Can you talk about how you push back against that trope and how that trope became so popular? Is it ingrained in our sort of Puritan ethic? What is the mechanism there, other than just rank propaganda?
Yeah, I think that that's exactly right. That is an objection that single payer opponents bring up a lot and that people ask about in good faith. What I usually respond is the idea that, I think that choice in some things is valuable to a lot of people. And in healthcare, when you think about choice, people want a choice of provider. That is very important. What we have now, what those people tend to be referring to when they say, but choice, they're talking about insurance coverage. And that's a situation wherein I'd argue that choice isn't something that we want or should aspire to. Basically, the ACA markets, the ones that are functioning how they're supposed to anyway, have a choice of several different plans that one can choose. And even people with employer-based coverage tend to have choice between at least a few different options. And those tend to be delineated either by company or by network. Each one has a certain network of providers or, certain things that they cover. A cost sharing scheme, so you can get a high deductible or a low deductible plan. High deductible plans tend to have lower premiums. Low deductible plans have higher premiums. You might have a plan with co-insurance, with co-pays, things like that. And so choice, when it comes to healthcare coverage, is something that can actually be very oppressive for the consumer. I think that anyone who's ever had the experience of shopping on the individual markets for a health insurance plan or of, flipping through the manual, trying to figure out what the heck is covered once you actually have one, that's not exactly a great situation.
Yeah.
And, choice between coverage is basically how we get tiers of access, how we get people with really, really good plans, really, really skimpy ones, and how now the conversation is being pushed even further toward the right. The Trump administration is trying to get shorter term plans onto the market as opposed to, ones that include the 10 essential health benefits. The idea being that now people will have the choice to have, even more meager coverage, but, for even less money. And so I think that choice when it comes to coverage misses the fact that that's not the choice that people want. People want the choice of provider. They want to be able to choose their doctors and stick with the providers that they have relationships with, not the actual coverage. Nobody has any emotional attachment to Cigna or Aetna.
How dare you? I have much corporate loyalty to my... Hold on,
Yeah.
I got to check my card to see what it is. Cigna, yes. I love Cigna.
Yeah,
I want to talk
too.
I want to talk about that a little bit here because this idea of choice is a perverse one. Obviously, you have the kind of Marxist argument that you don't have a lot of choice when you're starving to death. You don't have a lot of choice when, X million Americans have to go to GoFundMe to get a surgery done. That even the very notion of choice, it's the old cliche, choice without options doesn't mean anything. And for many people, they don't have any options. So what good does the concept of choice mean?
Exactly. I think that's absolutely the case. And I think that when you have someone who is very, very strapped for cash, the idea that they can now spend less for way less coverage isn't exactly an enticing offer. You're basically saying that you want to usher in a situation wherein poor people can afford risk and little else, that security, that genuine coverage costs more. I mean, that doesn't mean that there's actually a meaningful choice there at play.